Hi, I am so delighted in meeting you in JIP's Horse and Heart News. Yesterday, one more patient admitted for acute pulmonary edema with signs of acute LV failure with lot of crepitations. So, patient was given injection Lasix and started on dobutamine as patient's EF is around 20%. And with all these measures, patient gradually improved. Just I want to insist once again the management of heart failure. So when your heart is struggling to pump, how you can give much relief to failing heart? The first most important, the main task of heart is it has to pump the venous return. So whatever the blood that comes from the vein, that is called preload, it has to be pumped out by our heart. The first most important, the task would be, first we have to reduce the preload or we have to decrease the venous return. The two important best drugs for decrease the venous return is injection furosemide and injection morphine, among which injection morphine would be a powerful venodilator. When you give injection morphine, it dilates your vein across the body. When veins are dilated, so the veins are not capable of pumping the blood into the heart. So all the blood will be pooled in the venous bed. So there won't be any blood going towards the heart. That will give much relief. So morphine is one of the powerful venodilator which can be given for acute pulmonary edema. But only one thing is morphine can produce respiratory depression. So in outpatient setup, so it is very difficult to morphine, and you should be aware of or you should be wary of the respiratory depression induced by morphine. And second one, injection furosemide. So most of us assume that when you give injection furosemide, it acts at thick ascending lymph loop of Henle, by which it excretes water. So your pulmonary edema gets relieved. But it is otherwise. I could say it acts at veins first. It acts like a venodilator. It dilates vein enormously. So there is no venous return to the heart, by which it gives relieves pulmonary edema. Nowadays we start injection furosemide loading dose, then we will give 1 mg, 2 mg per hour based upon the blood pressure. When you give injection furosemide infusion throughout the day, please ensure that patient is not going for hypokalemia and volume depleted metabolic alkalosis that can be precipitated by injection furosemide. So these are the two important drugs that can reduce your venous return. Sometimes some patient presents with high blood pressure 180, 190 with acute pulmonary edema. At that time, probably you can choose nitroglycerin, because nitroglycerin can dilate your veins. So it is one of the powerful venodilator, and parallelly it dilates your arteries as well. So it dilates your arteries. So arteriolar resistance comes down. So it reduces your afterload. So your heart is able to pump against the decreased arteriolar resistance induced by NTG. So if somebody presents with high blood pressure and pulmonary edema, NTG plays a major role in reducing venous return, and it will reduce your blood pressure by decreasing arteriolar resistance, and in fact it decreases pulmonary edema because of reduction in arteriolar resistance and venous return, and it would be a coronary vasodilator as well. You should be reminded. Then we have seen the drugs which will dilate your veins. The drugs which will dilate your veins and arteries helps in pulmonary edema. Now you may ask one question, is there any other drug that can pump our heart, or is there any other drug that can enhance our cardiac pumping capacity? Yes, there are couple of drugs that can enhance your pumping capacity. One is injection dobutamine. Injection dobutamine can enhance our cardiac contractility, but when blood pressure is around 70 and 80, you should be cautious about initiating injection dobutamine. Once BP gets picked up, you can introduce dobutamine to enhance cardiac contractility. And second one, digoxin. Digoxin can enhance cardiac contractility, but it acts at AV node also. So it will be very useful in decrease in atrial conduction through AV node into the ventricle. I mean, when you have AF, it will be very useful. So when somebody has cardiac failure associated with atrial fibrillation, if you give digoxin, it will take care of your cardiac pumping activity and it can reduce your ventricular rate in atrial fibrillation by inhibitory action over AV node. So these two drugs. Now of late we are using levosimendan. This levosimendan is a wonderful drug. It is very useful in acute cardiac failure. So levosimendan is considered as calcium sensitizer. It acts in the troponin present in the cardiac muscle, by which it enhances your cardiac contractility. The advantage of troponin is it not only enhances your cardiac contractility, it has some influence on dilatation of veins and arteries. So it has more or less triple actions. So it enhances the cardiac contractility, it dilates veins and it dilates arteries. So it will be very useful in pulmonary edema. So these are the gross pharmacological treatment for cardiac failure. Then one more patient we received yesterday, 3 days of fever with tachypnea. So any patient who has respiratory rate more than 22 per minute in the absence of high temperature 104, 105 at the time, okay. So you have to think of sepsis. The earliest manifestation of sepsis is tachypnea. So when somebody has history of fever but respiratory rate more than 22 per minute, when there is tachycardia more than 90 per minute and leukocytes more than 20,000 and the temperature more than 38 degrees Celsius or even less than 36 degrees Celsius or hypothermia also, you can think of sepsis. So we have admitted a case of suspected sepsis, but we have to document the source of infection. So patient has been withdrawn 2 blood culture at 2 different sites and we have taken procalcitonin as well. The elevated procalcitonin may be useful in suspecting or diagnosing sepsis, but the first sample of procalcitonin may not show elevation, but it will never rule out sepsis. But the procalcitonin will be very useful when the elevated procalcitonin, when it comes down, you can de-escalate the therapy, antibiotic therapy, or when procalcitonin becomes normal, that should prompt you to stop the antibiotic. So yesterday these are the cases admitted. So we have learned few things from both these cases. Thank you.